Interpreting arterial blood gases can feel overwhelming when you are staring at a page of complex laboratory numbers. Many nurses struggle with where to begin, leading to interpretation errors and clinical confusion. The secret to simplifying this process forever starts with focusing on one specific value before all others. The golden pH rule dictates that you must identify the pH level before looking at any other parameters. Determine if the blood is acidotic or alkalotic to establish the primary baseline of the patient's physiological state. This essential first step clarifies whether the underlying problem is respiratory or metabolic in nature. Using this rule prevents the analysis paralysis that occurs from overanalyzing CO2 and bicarbonate levels simultaneously. By prioritizing the pH, you build nursing confidence and ensure accurate assessments every time you review lab results. Always remember the golden rule: pH comes first, every single time.